for you specifically today, we are talking about the annual election period. Now, some people will call it open enrollment, and often the terminology is used interchangeably. Technically, it is called AEP. The difference between an AEP and an OEP, or an open enrollment period, is when you first came aboard. So if you turned 65, it was your open enrollment period, or if you were working and then you decided at 70 that you wanted to come aboard, it was also your open enrollment period. Actually, they gave it a different name, but the key here is the AEP is for a 7-week defined period of time. It starts on October the 15th. It goes through December the 7th. That's when you can make changes that are effective on January 1st. So the little guy on the screen here, we haven't given him a name yet, but he is our little mascot for this year. So we've had kind of some fun with stuffed animals and, you know, flying in outer space. And the whole topic and goal is going to be helping you make a safe landing this year. Okay. There's a lot of info out there even about these folks going into space and space this and space that. So we kind of bumped off of that. So without further ado, here we go. You also should have received what I would refer to as an overview of 2022. Some of this is going to be a little bit repetitive or redundant because you might know a little bit about Medicare already. And then we're going to talk about what you can and cannot do during open enrollment and just give you some tips in some different areas as far as what to look for in a plan and what might be new this year. We also had a handout that we submitted to you that referred to some of the top mistakes. We'll address some of those. And then the third handout had to do with what's called Medicare choices. So I may refer to that as well because it's still confusing for people as to, I hear the word supplement. What does that mean? I hear the word Advantage plan. What does that mean? I hear the word Medigap. What does that mean? So again, the terminology is often used interchangeably, which can be kind of confusing. So here we go in an effort to get us out of the mud, as we said earlier. Okay, now it's not moving. There we go. The event or our webinar for this afternoon is strictly educational. As I said, there will be no plan specific information, but that information will become available after October the 1st. Here is a picture of our current team. One of the team members on the far right did leave last Friday. So in time, we will update the picture, but we have Lauren on the very far left. And then in the middle of the page there is yours truly in the white dress, along with her husband, Ron. So we are the founders of the practice, although we are divided into 2 different segments, one being the wealth management side of things. That's my husband, Ron, there in the middle. And at the far right is his partner, Nolan. So they're in the process of consummating a deal where Nolan will become the lead advisor and he will buy Ron out. For Nancy, she handles the healthcare side of the business. So it can be both the Medicare, which is our emphasis today, or people that are also under age 65. So if there's anyone in the audience that is under 65 and you need help with your health insurance, it's actually called the Marketplace. And those dates are going to be 11/1. And instead of 12/15, they just have extended the Obamacare Marketplace open enrollment to January 15. So they kind of overlap there a little bit with Medicare as well as those that are under age 65. The next picture is our team today, strictly the health insurance side. So we've got me on the far left there. Then we have my sister. Her name is Sherry, and she's been working part-time with us in more of an administrative kind of role, helping us. And we've got Lauren. She is licensed. She does most of the appointment scheduling, and she will also answer any kind of questions that you might have about Medicare or the product that you have, or how to read a summary of benefits, or how to do an analysis on your prescription drug plan, that type of thing. Kristen is the newest member to our team, and she is in training. and also has just recently gotten her license. And hopefully next year we'll be able to do much of what I am doing this year and have been doing for the last 15 years. So her goal is to be able to come aboard and to be able to help people. So there's a little bit more about me. Anything new? And that would be, I am independent, and that is important. I don't represent one particular insurance company. I have a whole litany of companies. And the reason for that is some of them have different benefits. And because we're all different and unique and have different healthcare needs, I think it's important that you have somebody who could say, this might not be the right plan, but here's another one that you might want to consider. So I'm a good listener. And if there's something that really rings true as far as what you're looking for or what you don't want in a plan, we're going to have the opportunity to go out to the marketplace. We are appointed by these insurance companies and be able to help you. I am not a one and done advisor. There's a lot of folks that will just take the Medicare application and you never hear from them again. That is not me, nor it is my team. This is our busy time of the year because it's open enrollment. We extend an invitation to all of our clients to come in and talk. We do it by way of one-on-one, or we also do it by way of seminar or by way of webinar. So we're in the process of sending those kinds of announcements out, and we anticipate being very busy. And again, having more people this year, staff-wise, to be able to help with those needs. Today, we're going to just do a brief overview of those Medicare parts called A, B, C, and D. We're going to talk about some costs and coverage. The 2022 costs and coverage has not yet been released. I would anticipate that happening probably at the end of October or early November. And most likely, because there is an anticipated cost of living increase, about 6%, there will be an increase in the Part B of Medicare. And that's what everybody pays for if they are on Medicare. And again, today's presentation is geared towards a Medicare recipient or beneficiary. We're not talking about Medicaid today. It's for people that have worked, paid into the system, and they're off and running and don't have any other kind of income requirements, if you will, that would constitute a Medicaid kind of situation. Talk about some critical facts, what you need to know about the supplemental options. Some of them you can replace every year. One you cannot. It would be subject to medical underwriting, what to look for, that type of thing. We'll talk about maybe some new things in 2022 that are important that you take into consideration in making that decision for 2022, and some other tools and resources that may be new to you. So when people come and see us or call us on the phone, this is pretty indicative sometimes of people, and they'll say, you know, I know I'm on Medicare, but I don't even know what I have. And the first thing I do is I say, let's see what you have in your wallet or in your purse. So we pull out the cards. In fact, I had that earlier today. She said, I'm in Medicare. I said, I know you're in Part A and Part B. And she took out her Medicare card. She said, well, I think that's all I have. And I said, no, I think you have another card in your wallet. And sure enough, there it was. And it was white and green for those of you that know whose card that is. And she said, oh, I have an Advantage plan and it's called Part C. I said, yes, it's one-stop shopping. So we're going to talk about that. The person that pulls out 3 cards from their wallet, they actually have original Medicare. They have a prescription drug plan that is standalone, and they also have what's called a Medicare supplement or a Medigap. So we're here to try to simplify the process, make Medicare easier to understand, and make sure that you know that your supplemental choice may change from year to year. So you want somebody to make sure that they spend some time with you to review it. Some of you may have an agent, and if you do, go back to them. You know, they are receiving a commission every year as a result of your renewal. So they should be contacting you. If they're not, certainly we are here to help you in any way that we can, but just keep that in mind, as well as all of the agents receive the same amount of the commission. So the government is very specific on what we are going to be paid for what we refer to as a new enrollment. We all receive the same amount. The same thing with The renewals, we all receive the same amount. So just to kind of put everybody on a footing, if you will, when you first turn 65, the enrollment period, and Medicare is big on these enrollment period types of scenarios. The initial enrollment period is the first one that you may or may not have taken advantage of. So you had to be 65 and you had to say, I want Part A and Part B because that's the right thing for me to do. I did a presentation last night through community ed, and I would always remind people, just because you're turning 65 and you get bombarded with information that makes it sound like you better do something, that doesn't mean you have to do something. If you are still working and there's more than 20 employees and you're on a health savings account plan, you probably don't want to do anything. So those are the things that we will guide people on to say, let's look at your plan. Let's see what makes the most sense. Do you need to take it or do you not need to take it? The next enrollment period that applies for people that did not enroll in the IEP period is called an SEP. It stands for Special Enrollment Period. So if somebody is decided to continue to work, they didn't sign up for Part A or Part B, but now they're 70 and they want to retire and they want their Part A and Part B, it's going to be called a Special Enrollment Period. And the government gives you 8 months to actually make that all happen. And there are 2 forms that are required because the government wants to know why you weren't paying the Part B. They're looking for their Part B premium monies from you. So these forms will explain to Medicare and Medicaid, the government's programs that are running this program, that you were working. And that is why you did not have to pay for a Part B. You were working for a company with 20 or more employees. So that's the dividing line. If there's 20 or more and you're working, you don't sign up. If there's 20 or less, you do sign up, and that's generally during your IEP. But today, where the emphasis is on the AEP. So the AEP is that period of time that you can make a change. Now, if you decide to stay in the same plan, and they are all going to be sending you information by the end of this month, and some of you have already received it, because folks have called and said, oh, my premium went from X to Y. It went up, it went down, it doubled. There was one plan I just heard about, it tripled. And I'm like, really? So you can be guaranteed that those folks will be contacted by us and we'll be saying, we need to revisit your Part D. It went from this premium, it tripled. You probably don't need a plan that's that expensive. But many of my clients will stay in the same plan. They will do the review on their own with the documentation called the Annual Notice of Change, ANOC, or they'll come in, make an appointment, or attend a webinar or a seminar, and they'll have a better idea of what they need to do or not do. If you do nothing, which is fine, as long as you've done the review, it will automatically renew. There is nothing for you to do. You just let it go. And after 12/7, which is the last day that any change can be made, they'll automatically keep you in the same plan. Sometimes you get a new card for the next year, so on and so forth. The effective date of any change made through the annual election period is always 1/1. Now, I did not put it on the screen, and you didn't hear me tell you this, but if you have a Medicare Advantage plan, they're actually going to give you one more quarter, or the first quarter of next year. That one, I think they actually call open enrollment for an Advantage plan only. So if you have an Advantage plan and you made a mistake, you didn't revisit it, you found out about a better plan after January 1st, you actually get to come back one more time and make a change. As an agent or an advisor, I'm not allowed to broadcast or publicize that particular enrollment period, but you will hear about it on TV. You might read about it, and just keep that in the back of your mind that if for some reason you needed to revisit your Advantage plan, you still could do it in the first 3 months of next year. Then it becomes effective the first day of the subsequent month. So again, Window of time, October 15 through December 7th, effective January 1st. Please make sure you review the annual notice of change. It will tell you what the premium was, what the new premium will be, and many times they will detail for you the changes that are also being made. It could be copays, it could be something about out of pocket, it could be a new dental benefit, it could be a variety of things. But a lot of the companies do a good job of showing you in advance, kind of at a glance, what really is changing, rather than you having to thumb through 50 pages trying to figure out what the old one was and what the new one was. Most importantly, do not leave your plans in autopilot. In fact, that really is the number one mistake people make. They leave it in autopilot. They don't revisit it, and then they find out their medication isn't covered. They found out that their doctor doesn't participate anymore. I had a number of clients that said, oh, I had an over-the-counter benefit that I could go to Walgreens and I could get these free items. They didn't even know about it. But you know, if they had read their material, and I know it's a lot, or called their advisor or called us, we'd be happy to share with those types of things that you may not be even aware of that could be new. And you want to make sure you take advantage of all the benefits that are available to you because you're paying for them. So here are the changes that you can make. You can move from one Medicare Advantage plan carrier to another. So I've got them all. I've got Priority, Blue Cross, Blue Care Network, Humana, Aetna, HAP, and WellCare. So if one year you wanted to try Blue Cross and you had Priority Health, as long as your doctor was in the network, there's no reason why you couldn't try it if you wanted to, but you don't have to. The next one is many of these plans have many of these insurance companies have multiple plans. So one of the carriers has 8 different plans. What happens is when you first sign up, you will only always receive information about your plan. So there are 7 other plans. You might find that there was one introduced, they didn't make you aware of it because they really don't have to. They're assuming you're going to stay in the same plan. And you might then uncover that you could have actually made a change, but you didn't even know that there were 7 other plans to pick from. So that's what we will help with. We want to make sure that there are no missing facts. And in my opinion, that is a missing fact. So unless you go out to the insurance carrier's website and see all of his plans or her plans there, you're not going to know that, you know what, they had another 0 premium plan. And you could have had a PPO instead of an HMO. Or you could have had an over-the-counter benefit of $75 instead of $25. So that's, again, the importance of revisiting your plan so that you've got the best plan for you. You can change from one Part D prescription drug plan to another, and there are probably 29 different prescription drug plans. We've got WellCare, we've got SilverScript, you've got United Healthcare, you've got Humana, so on and so forth. We've got access to the vast majority of those, and we will do an analysis for you at no cost. You can also disenroll from a Medicare Advantage plan. You do have to let them know that you want to leave, and you could apply for a Medicare supplement. So earlier I said one of the do's and don'ts or considerations is the following. The Medicare Advantage plan does not have any medical questions that are ever asked. You only have to be eligible for Medicare. They don't care what age you are, male or female, you smoke, you don't smoke, whatever the case may be. But the Medicare supplement company does. So if you started in a Medicare Advantage plan and you hopefully knew that there was another option, and you came back to me and said, I'm interested in the Medicare supplement, I would first be showing you the medical questions. And you would say, I think I can answer them all. And we would fill out an application together. They would call you on the phone, and you would either be accepted or you would not be accepted. At that point, you would not cancel your Medicare Advantage plan until you knew you were accepted. So come this fall, I know I'll have people that will come in October and early November, and they will say, I would like to leave the Advantage plan. I would like to apply for the Medicare supplement, and that will be the process that we will use. An individual also could return to original Medicare. So that could again be the Medicare Advantage plan person, which is otherwise known as Part C. So A is the hospitalization, B are all the medical services, C is a Medicare Advantage plan, and D is a prescription drug plan. So once in a while, there might be somebody I can't think of a specific reason, but where they would say, I don't want to be a part of the Medicare Advantage plan family anymore. They can drop the Advantage plan at the end of the year because you're always committed for the whole year. And they could go back to just original Medicare, and then they would add a prescription drug plan to it. So if there's anybody who is getting ready to turn 65, know that at a minimum, you must be in Part A, Part B, and Part D. Part D, if you do not sign up for it when you were first eligible at either 65 or when you dropped your group plan coverage and now want your Medicare, if you don't sign up for it, there's a 1% penalty for every month that you did not sign up. So we highly recommend people go with even the least expensive plan just to have a placeholder so that Medicare doesn't come back when they do need drugs to order and then attach to that a penalty to the premium. And you can certainly add a Part D prescription drug plan. This past weekend, I was up north. I ran into a couple. I'm looking for the rental of a storage unit, and it turned out that the husband, who wasn't returning my calls, had just gotten out of the hospital. And I said, is he on Medicare? Do you have a good plan? Is it going to take good care of him? She said, we never had a need for drugs, so we never signed up for it. Now he's on 7 or 8 medications. Will you help me? So yes, I will go up there. I will help her. She'll put together a list of meds. They're going to have a penalty for the 2 years he should have been signed up that he wasn't. It shouldn't be all that significant because what's more important is that he has a drug plan rather than paying the retail price or even using some of the drug discount programs that are out there. So very briefly, Medicare was introduced in 1965. It is different than a group health insurance plan, although it still has the design of copays, deductibles, coinsurance, premiums, all that same terminology still applies. Again, not to be confused with Medicaid, and it is administered by Medicare and Medicaid. I am not employed by Medicare and Medicaid, although every year I do have to pass my certification with basically Medicare and Medicaid, and then with every insurance company that I represent. So it takes me the whole month of August to get through all of the certifications. Eligibility is based on someone being 65 or older, unless they are on Social Security disability. Then they could be under the age of 65, or they could be someone that has end-stage kidney failure or renal disease. You also must be a legal resident and have lived in the United States continuously for at least 5 years. Here are those 4 parts of Medicare. A is your hospitalization. Make sure that you are admitted as an inpatient because they will bill it all according to the rules of Part A. Part A includes your being admitted to the hospital, your room and board, your MRIs, your CAT scans, your doctor's visits, your food, the medications they give you while you're there, so on and so forth. Part B, you're out of the hospital. You've gone home. The doctor may say you need some blood work. That's going to be Part B. He may say you need physical therapy to get back on track. That's going to be Part B. You may need an outpatient surgery. You don't have to be admitted, but you could go in, get the surgery taken care of, and then go back home. That's Part B. There are some drugs that are billed under Part B, specifically anything that's an infusion type of drug. So people that are receiving chemotherapy, it will go through the Part B, as in boy, of Medicare and not the D. So although the D is prescriptions, in that example, if you go to a medical center where they're going to deliver the chemotherapy or the Remicade or some of these other infusion drugs for osteoporosis and so on, that goes under the Part B of Medicare. So there's your Part C, very, very popular plans. I would probably say more and more people are leaning towards the Advantage plan. I'm going to estimate, because I've seen the Kent County number, that I want to say probably about 60 or 65% of people are in the Medicare Advantage plan. The balance of them are either in a Medigap plan or they don't have any additional supplemental coverage. And they have only A and B, which is again referred to as original Medicare. So if you have original Medicare, that's only your red, white, and blue card, and you do pay a Part B premium. The base premium for Part B this year is $148.50 per person per month. If you are on Social Security, they will automatically deduct it from your Social Security retirement check. And if you're not, then you will receive either a monthly bill or a quarterly bill. The quarterly bill will generally go to people that have the base premium of the $148.50. And then there are some folks that are referred to as a higher income beneficiary, and they are generally allowed to pay theirs monthly until they're on Social Security. Now, most people don't call their Medicare Advantage plan a Part C, but it technically is a Part C because the government does oversee all of the parts and pieces in the plan design and the premiums and what they're going to include and what they're not. So every Advantage plan company has to get the approval from Medicare and Medicaid for their upcoming plans. So by October 1st, they got to be good and ready to go, and it has to be published. The Part D, again, is the prescription drug plan. That's where you might hear about the donut hole or the coverage gap. We'll touch upon that just a little bit as well. That program was introduced in 2006. Probably the Part C has been around, I'm going to say close to 20 years, because I've been doing this for about 16 and it was in place when I came aboard. And it's here to stay. There was a time where people thought the Advantage plan was going to go. It's not. It's here to stay. It's managed care. So there's my $148.50 for the Medicare Part B. Again, there are deductibles, co-insurance, so on and so forth, if all you have is original Medicare. And most people don't. They've gone ahead and added to that, and that's the time of the year that you get to make a change on those specific plans. But everybody has to be in Part A and Part B. This is the diagram that you would see if you would come into my office, or if you were here and we were talking further, because I often will differentiate between, are you on the left side or are you on the right side? And again, if people don't know, I often say, let's see what you have in your wallet. What do you use for your insurance cards? Because I think it's important that you know what you have. So if someone asks you, you know that it's an Advantage plan, because they work very differently. It doesn't mean one's better than the other. It simply means they work differently. And as long as you know how they work, and that your doctors are in the network or that they take Medicare. And there is a set of criteria that we definitely look at. But again, there's no wrong answer here. It just works differently. So on the left side is somebody that's in Part A and Part B, because everybody is. Same thing with the right side. And here's where I talked about the cards in the wallet. So the person on the left side, he has or she an opportunity to replace his Part D every year. We spend a lot of time on the analysis, making sure people have the most cost-effective plan for the upcoming year. Then they have the supplemental coverage, sometimes called a Medigap or a Medicare supplement. If you're on one of these, chances are you're on either plan N as in Nancy, F as in Frank, or G as in green. Each plan virtually covers all the out-of-pocket expense with a little bit of exceptions. So the plan F does the best job of covering all the out-of-pocket from original Medicare, but you had to be born and in Medicare prior to January 1st of 2020. So anybody born in the year 1955, you are not eligible for plan F as in Frank. Your plan is probably G. The only out-of-pocket expense for G is a $203 Part B deductible. I have plan G. So I first satisfy my 203. If I go to the doctor and his bill is $125, I don't pay a dime. It goes right to Medicare. Medicare says Nancy paid her Part B premium. I'm sorry, she paid her Part B deductible. And her plan says we pay whatever is remaining there. So they would pay the entire bill to the doctor. The doctor does need to accept Medicare assignment. Just keep that in mind. Not so much for the Medigap is it a problem, but once in a while it will be a problem on the other side as far as if the doctor doesn't accept the Medicare assignment, which means if the doctor bills you $200, if the doctor's bill is $200 and Medicare says I'm only paying $150, the difference is $50. They can charge in some situations up to 15% of the $50 difference. So although it's not 50, you're still going to be paying 15% of the 50, and that would become your responsibility if they don't accept the Medicare assignment. But anyway, back to the left side. Why did I pick the left side? I picked the left side because I have a pre-existing condition, and I had breast cancer 8 years ago, doing great. But you know what? I thought, I want the best plan for now if I ever had to go back and I needed chemo and I needed radiation and I needed some of the other specialty services. So for me, that was the best place to start. Will I stay there for year after year? I don't know, and I doubt it. Because if my health stays pretty good, there's a likelihood I'm going to move to the right side, and that's going to be the Medicare Advantage plan. But on the left side, you do get to pick the doctor you want to choose. Has to take Medicare. It's not about the network. So you're not looking it up in an HMO or PPO or an LMNOP. You get to go see that doctor as long as he's taking new patients and he's taking Medicare. You're good to go. You can also travel anywhere in the United States, and you don't have any additional costs because you're not going outside the network. There is no outside the network. So if you're in Florida and you paid your Part B deductible, like I told you in my case of $203, because I'm on Plan G, I go to Florida and I need to go see a dermatologist when I'm there. I find one, they take me, they take Medicare, I present my cards, and zero. I don't pay anything. So I have no out of pocket, no deductibles, no copay, no co-insurance. This is strictly the medical side of things. And then again, you have to select a Part D plan based on your medications. On the right side, it's called a Medicare Advantage plan. So the premiums on the right side, they're going to be a lot more than they are on the left side. The left side, when you turn in 65, starts at about $100 and some. There's a difference between male and female. Every year on the left side, it goes up based on you turning a year older. So on the right side, the Medicare Advantage plan, this year more than ever before, I saw zero premiums on lots of plans. So here's an example of what my dad did. He's 88 years old. Last year he came to see me and he said, I'm on the left side. I'm paying $200 just for my Medigap supplement. I go to the doctor a couple times a year, maybe a specialist. That's it. Why would I pay $200? $2,400 for the year. I don't get dental. I don't get vision. I don't get hearing. I don't have an over-the-counter benefit, and I don't have a health club. I said, well, Dad, I think it's time to look at the Medicare Advantage plan. So that's exactly what he did. He moved to the Advantage plan. We verified his doctors were in the network. We looked up his prescriptions, and he is thrilled that he now has dental coverage, vision coverage, and some of the other extras. So the way he looked at it was, he said, I'm going to take the $2,400 that I saved and not paying on the left side with the premium. You told me all my doctors take the plan, plus the networks are much larger than they ever have been before as far as participating doctors and hospitals and labs. So he said, I will use the $2,400 that I save in my premium to use towards my copay. He happens to have a plan where his primary care is zero, cost him nothing, and he has gone to a few specialists to the tune of $35 or $45 a time. So he's way ahead. I talked with him last night. Dad, are you happy where you're at? He said, absolutely. So if there's anybody out there that's on a Medigap and you want to revisit, look at a Medicare Advantage plan. This could be a good year to do that, okay? Also keep this in mind. If you started with the Medigap when you turn 65 or were first eligible with your Part B, you have a trial right. You have the ability to say, I want to try the Medicare Advantage plan in 2022. And if halfway through the year or anytime during that first 12 months, you think, oh, I just made a big mistake, I don't want to do this, the carrier or insurance company that you left has to take you back without medical underwriting. I've had it happen twice where people in months future went to the doctor, got a diagnosis of cancer or something real serious, and they said, take me back. I don't want all those copays. I don't want to have to look up the doctors in the network. I want to go back to what I'm familiar with. So they will come back on in the rate based on whatever their age is. But the good news is, even though they had a cancer diagnosis, they can come back as long as they did it within 12 months. And they have to be received by the former company that they left. That's the rule. It's called a trial right. On the right, what's important to remember when you're evaluating your risk is that all the Medicare Advantage plans must have a maximum out of pocket. It does not include the drug costs or the copays that go into this bucket, but all your copays and deductibles and coinsurance will go into a bucket that they will keep track of for you every month, and they will send you a statement. The average maximum out of pocket for the plans is right in the neighborhood of about $5,300 to $5,500 per person per year. So if you ever hit that threshold, they will tell you that they will pay for the next copay or the next hospital visit or the next specialist visit, so on and so forth. It takes a lot to get to the $5,300 or the $5,500. So the more you pay in premium, the lower your maximum out of pocket will be. So a lot of the zero premium plans this year had maximum out of pockets right in that $5,300, $5,500 range. My mom has a plan that's in the $80 range, and her maximum out of pocket is in the $4,000 range. So it would make sense that the more you pay in premium, the lower your maximum would be. So many people that are relatively healthy look at that and they say, wow, I can have the dental, vision, and hearing. Those are the extra benefits offered up by the Medicare Advantage plan company. And they have the safeguard of knowing they have the catastrophic level. The other thing to keep in mind is there is generally no big deductible you have to first meet on the Advantage plan side. Most of those plans are good from $1. So if you signed up for a zero premium plan, you went to the doctor, it's highly possible it's zero. You don't have to come up with the first $1,000 like you did on a group plan, and then it became zero. So keep that in mind. Biggest mistake, doing nothing, just leaving it in autopilot, forgetting about it and saying, well, I think it'll be fine. It might be, it might not. So here's a few more critical facts. You can change plans and companies at any time of the year. That is for the Medigap, the Medicare supplement, not the Medicare Advantage plan. So those of you that might say, I love the Medigap, it's just gotten a little expensive. If you are still relatively healthy and you can answer the questions, and we'll go through them with you, you can revisit your existing plan. And I do that all the time for people. The best time to do it is not during open enrollment, because we're very busy. So I encourage people between January and September, if your plan's going up, and it does, it goes up every year, and I'm about ready to revisit my husband's because it's inching up to the $200 range. I'm going to revisit it, see whether he can pass the underwriting, and I'm going to submit it. And there's a high probability that I bet I'll probably save anywhere between $300 to $500 for the year, but you have to pass the medical underwriting. Again, it's just a series of questions. They don't come into your home. They're not going to request your medical records. You just have to answer the questions honestly. We told you about Plan F. That has gone away, but if you were in Medicare prior to 1/1/2020 and you want to revisit your Plan F, you can still do it. It's still there. It's still being sold, but you have to have come aboard Medicare prior to January 1st of 2020. The plans are all standardized. Some of you have Plan F, Plan N, Plan G. Once in a while, we'll see some of the other plan letters. Keep in mind that Medicare has parts A, B, C, D. Well, Medigap also has letters that are the very same, but they are plans. So the plans plug the holes in the parts. That's the idea of the supplemental. Now the Medicare supplement, it has no network. You can go to any doctor that takes Medicare. You have coverage anywhere in the United States, plus some international coverage, virtually no out-of-pocket expenses, and they're guaranteed renewable. So unless you don't pay your premium, they can never seek you out and say, oh, look at all that money we spent on the replacement of your kidney or whatever's happening out there. They indeed price everybody based on a big group of clients in a certain age, where they live, so on and so forth. And then they have to go to the state of Michigan with their rate increase recommendation to get it approved. The rate increases are more than what they've been in the past. I'm seeing anywhere between 7 to 10%. And again, it could be a revisit reason. It could be it's time to look at the Medicare Advantage plan, or you might say I can live with it for another year and then I'll take a look at it. But they generally go up every year. Here's the Part D. The Part D, keep in mind that the government says no matter what plan you have for Part D, and it could be built into the Medicare Advantage plan because it's C and D combined, or on the left side where we have the standalone prescription drug plan, the government says they must have medications that cover any possible category of medical malady: high blood pressure, gout, vertigo, cancer, whatever. So the companies get to decide which drugs they actually put out in their formularies, because that's what it's called. And sometimes you find that the more brand name, one of a kind, just been recently introduced kinds of drugs, they may not appear on everybody's formulary. So that's a good reason to double check it. Sometimes you find that the medication will change from one tier to another without revisiting it. But the bottom line is, chances are whatever ailment you have and the medication that you are taking, it's probably on the formulary. And if it is brand new, that's why you want to go out and revisit it. That was true of Eliquis for a while. When it was introduced, it wasn't on everybody's plan and formulary. So some people got left out and they didn't pick it up until the next time they looked at their plan and had somebody do an analysis for them. We talked about when they can actually make the change, and all the prescription drug plans that are on the left side have a premium. They could be as low as $6.90. They could be as high as $100 a month. They all have an annual deductible. It may or may not apply to your plan, but chances are they have an annual deductible. The company can either waive it in its entirety. They can charge you a portion of the annual deductible. And sometimes the annual deductible only applies to a certain tier. So there's a fair amount of, okay, I better look at this and look at that. Again, when we do the analysis, we try to give you an idea overall what the cost will be for the year, so that you know what you pay per month, so you know whether you're going to have to pay anything towards the annual deductible and which drug it is. And then if there are copays, some of the plans have mail order and the copay is $0. So keep that in mind as well. There are different kinds of pharmacy setup arrangements. You can go to a retail pharmacy. Those would be Walgreens, Walmart, Myers, so on and so forth. And then we have copays, coinsurance, coverage gap, and catastrophic levels. So more to come a little bit on the cost part. These are what we call the stages. And I don't know if anybody's out there in stage 3, but that's often known as the donut hole. And the donut hole is a result of spending over $4,430 of retail value. So everybody starts out in stage 1. You may or may not have the deductible. Now, the assumption is here that you had a premium, so you paid a premium monthly. You may or may not pay anything towards the $480 deductible. This is actually the 2022 data. It says 2021, but it's actually 2022. So stage 2 says the government and the drug plan that you're in is going to keep track of on a monthly basis what the retail value is of all those drugs you came in to purchase. So I'll use my mom as an example. She's on Eliquis. So let's say that the Eliquis is $400. That's the retail price. My mother pays a copay of $42. Her plan, for simplification, let's say she doesn't have to pay the deductible. She's right, good from the get-go. But what happens is every time she fills her prescription with a retail value of $400, you can see that by the 11th month, she finds herself in the coverage gap. So in her case, she would only have 1 month, because all these renew and they reset every year, of paying more. What is the more amount? The more amount is taking the $400 retail value and multiplying it by 25%. So she would pay $100. So I only used one drug. In the case of my mom, she takes multiple drugs. So all of the retail value drugs could be a $20 retail value, a $400 retail, a $3 retail, whatever. They all accumulate. And my mom doesn't end up in November. My mom ends up more in July. So I've cautioned her. I said, Mom, couple things. One, make sure you know where you are and when you're ready to move into the donut hole. Two, plan on you paying more. It's going to be about 25% of the retail cost. Three, the retail cost could change from month to month because Eliquis isn't always sold for $400 through Walgreens. 1 month, the retail price might be $435. The next month, it might be $395. So anytime you have a percentage that's applied, keep in mind that the retail drug is not a static number. It's all over the place, okay? Now, I know that Congress is trying to make inroads in these areas, hopefully to simplify it, which would include more of a standardized drug cost that people could kind of anticipate, because otherwise you're talking to the pharmacist often going, why did I pay $100 last month and this month I'm paying $125? Well, that's why. Now, there's a couple things that you can do to try to avoid the donut hole. The first one might be ask for samples from your doctor. The second one might be, doctor, I can't afford this retail price drug. Is there an alternative? Is there something that's been out there that you think is close or as good? Yeah, it's nice to have some of the latest and greatest medications, but maybe you can't. Prior to Eliquis, which was more, it made it easier for my mom because now she's in assisted living. There is Coumadin. Now there's some pros and cons on Coumadin, but it's a whole lot less expensive. Eliquis is a blood thinner, so it's something that they're keeping track of. So anyway, don't be afraid to go back to your doctor and say, you know what, doc, I can't afford that. I've seen that with new eye drops. They're very expensive. I've seen that with creams and ointments. Try to get some samples. The other thing is there is GoodRx. GoodRx is a discount program. You simply go into goodrx.com or ask the pharmacy. They often won't offer it up. But if you're there, say, you know what, would you help me with a GoodRx? And they'll look it up if you ask them. And they'll run that same Eliquis through GoodRx to see whether, one, it would qualify, and two, if it could be less expensive than buying it at the $100 value that I gave earlier. So you have to kind of manage your own meds in finding the best possible ways to keep the cost down. Some people go to Canada for their medications like Lantus and some of the other insulins. The other thing you might consider is some of the pharmaceutical companies will have assistance programs, and they are based generally on your income, not all of them, but some of them do. So you might have to just do a little bit more research, but we're more than happy to try to help you and give you some tips on things that you might want to be able to look at. The last stage is called catastrophic. And the long and short of that is they're accumulating all these numbers along the way, and the bucket is you have paid and you have accumulated and they have used the retail cost. And once you hit $6,000 some odd dollars, I can't actually see the number, it will result in you paying the 5% of whatever that value is with some values that are there. You can see it right now. I don't have it memorized. So next one, Part D critical drug coverage few more facts. I spoke of the cancer in the, I don't know what that word is. Can we move this? Yeah, okay. So immunotherapy, there you go. Vaccinations, they're all going to be part of Part B. Remember the penalty if you're not signed up, do it as soon as possible, and you'll bite the bullet, but you'll have the penalty going forward. Yes, it's the rest of your life, but at least you've tried to minimize it. If you currently have Veterans Administration coverage, you don't necessarily need a Part D. You can get your drugs through them. They don't have them all, so sometimes people will sign up for a Medicare Advantage plan with drugs or even buy a separate drug plan, because you can have two. You can have both the VA or the other. And then you decide which one you're going to use. TRICARE for life are people that have been in the military. They've got very good health care coverage. They do have to be signed up for Part A and B, and they also have prescription drug coverage. So I talked a little bit about the donut hole and how you go about figuring that out. Keep in mind, you don't necessarily want to pick the lowest premium. It may not be the right plan for you. Your medications are different than your husband or your wife's or your neighbor's. The pharmacy also comes into play. A lot of the name brand pharmacies, the Meijer, the Walgreens, the Rite Aids, they are preferred pharmacies, but not always. Walgreens, for some reason, has kind of fallen out of favor, and they're not on a lot of plans as a preferred pharmacy. So again, the reason to have somebody kind of help you through that, we know which pharmacies go with which plans and which ones are preferred. I have once in a while people come in and they're like, this is really expensive. And I find out they're going to a standard pharmacy. Well, a standard pharmacy are more mom pops, home pharmacies, what's the last name? Home something. Sorry about that. Hometown. There we go. Hometown. Or a K's pharmacy, but more of a local pharmacy. And I know some people have relationships with their pharmacists, and once in a while we can find a plan that works with K's pharmacy. So we need to know that when we do the analysis. So again, don't leave your plan on autopilot. Seek professional guidance. We do show people how to do analysis on Part D if they want to know. I've got clients that will do the analysis and then they still come in and they'll say, Nance, will you take just one final look to make sure I did this right? And then we finalize it together. So that's fine too. If you want to know more about how it works, we're very much into helping you. So critical facts on the Medicare Advantage plan. Much of this we've already talked about. I'll only tell you that even though you're in Part C, you still have to pay for Part B. Sometimes people think that, no, don't have to pay. Yes, you technically can put your Medicare card away, except for the first time you go see the doctor, because they want that Medicare ID number off of it. But other than that, you can only use and get by very nicely with just your one-stop shopping card. They have a network. Now, the beauty of the plans today are most of them allow you international coverage. So whether you are in Paris, France, or you are in London, England, you have emergency or urgent care coverage at the same rate that would take place here in Western Michigan. Most of the emergency coverage is at $90. That is, you walk into the emergency room, maybe you thought you had a heart attack and they say, no, this is indigestion. You're paying $90 in Paris, France, and walk away. They also have the ability, though, if you're admitted to a hospital in a foreign country, many of them have companies that will help you kind of navigate your way out of the out of the country. There we go. And you still are only subject to the hospital copays. So if your hospital copay was $325 and you were there 3 days, you're paying the same $325 times 3 in Paris, France, as you did in Grand Rapids, Michigan. The same thing with out-of-state coverage. Many people go to Florida or Arizona and snowbirds. These plans are much more attractive than they ever have been before. I would probably recommend a PPO for a traveler over an HMO, but as far as seeking medical services at the same rate as what you would pay in Western Michigan, most of them are designed that way. It's when you go outside the network that you pay more. So we can always talk about that because that does kind of vary from plan to plan. Most of the plans all have that added value coverage of dental and vision and so on. So as an aside, some people were surprised when they went to get their Shingles shot. It turns out it is a tier 3, so you most likely have a copay. So again, if you're not on Medicare yet, get your shot because a lot of the plans will cover it at no charge. We talked about the fact that infusion and injectable drugs are a Part B, not a Part D as in David. You can revisit your Medigap plan any time of the year. You can, and keep in mind that when you do come aboard any part of Medicare, whether it's Part A or Part A and B, you cannot continue to contribute to an HSA. So once in a while, I'll run into somebody who's still on an HSA and they're in Medicare. You can't do that. When you sign up for Medicare, you have to stop any contributions, but you can still use all the monies for your medical expenses according to the HSA rules. You cannot use the Medigap premium as an HSA paid amount. So you can't go into your HSA account and say, I'm paying my Medicare supplement Plan G premium of $125 out of my HSA. They won't let you do that because it's private insurance. But you could take your Part B premium of $148.50 and you could pay that out of your HSA monies. Or you could use your $45 specialist payment to the Advantage plan and you could pay that out of your HSA. What is not covered by Medicare? They don't cover custodial care or long-term care. You don't have to be in the nursing home to need day-to-day care. They don't cover care outside of the United States unless the plan offers it up. So this is just original Medicare Part A and B. They don't have dental, vision, and hearing. Now, if you're on the left side of the diagram, I do have those plans, but they're all separate plans and they are all a la carte. So you'll add them to the numbers on the left side. They don't cover facelifts. Too bad. They don't cover acupuncture, except that they're starting to make some inroads with that. So last year they did introduce a couple of visits of, I'm trying to get over here. There we go. They did introduce a couple visits of the acupuncture on the plans, but you are limited to working with acupuncturists that are Medicare eligible, if you will. They take Medicare and that's their area of expertise. And then we talked about the amounts over and above the approved amount, and that was the Medicare assignment. The COVID-19 lab tests and anything else related to COVID-19 is still at no cost to you. Telehealth is here to stay. If you've done that, you can do it with a specialist, your primary care, and even your mental health professional if you're comfortable with technology. Insulin for the second year, not all, but a lot of the insulins to JO, Lantus, they're going to have a $35 copay. They're not going to be subject to the donut hole. So even though they have a retail price of over $400, that will not go into the donut hole calculation. And there are a few plans on the standalone Part D that do have some more coverage in the donut hole than applying that 25% factor. They will actually help you get through the donut hole in a little better way, a little more cost effective. So here are some tools and resources that you may or may not know about. Certainly the website, Medicare.gov, we use it all the time. If you come in, you'll see us using it. There also is a Social Security Administration.gov website if you're interested in learning more about your Social Security if you haven't turned on your benefit. It's also the website that you would apply for your Medicare Part A and B if you were getting ready to turn 65 and take your benefits. Because if you're on Social Security and you turn 65, you automatically get your card in the mail. All of a sudden it shows up about 3 months in advance of your birthday. The mymedicare.gov is a website. They encourage, and we do too, that once you're on Medicare, sign up. When we do the analysis today, we ask for your sign-on information. You can either give it to us in advance and we keep it confidential, or you can do it on the fly with us. But no longer can we save the medications and do the analysis on the computer. The only way we can get to the 12 medications that you take is we have to be able to get into your My Medicare account, and then we can see your meds, and then we can hit the buttons and go bing, bing, bing. This is the best plan, and this is the reason why. Next one, Medicare and You is the new booklet that will be coming out. It's multi-pages. Again, in the back of the book, you've got plans for C, or the Advantage plan with all the rates and all the territories. Advantage plans are based on where you live. So it's generally based on your zip code and county. So if you move to the east side of the state, you might have a different rate versus if you go to the Upper Peninsula, you're probably going to have a different rate. Nobody has the same rate unless 0 is 0 is 0. Websites, feel free to go out to Priority Health. They've got a great website. So does Blue Cross, so does Humana, and they'll tell you more about your benefits as well as Medicare. And then talk to your friends and relatives. The only thing I would recommend is if you talk to somebody, make sure you know, are they on the left side or the right side? Because if they're on the left side, they probably pay more than the person on the right, but ask them how much they pay to go to the hospital. Because a person on the left side pays nothing to go to the hospital. It's all covered by their supplemental. A person on the right side, although low, they could pay a couple $100 for every day that they're there. So there's a big difference. So sometimes I'll help people say, why would you pay $100 for that? And then I say, but how much do you pay to go to the hospital? You just told me that you were in there for back surgery. What did that cost you? So that's kind of what you're weighing. You're looking at it and saying, what do I think my health's going to look like for this year? But then you're also planning for the future. You're planning and anticipating what those future needs might be. And most of us are not going to get better and healthier and stronger. We're probably going to need more meds and need more medical attention. So make sure you understand how your plan is going to work as you need more medical attention. So we're coming in for a landing. I'm a couple minutes over. You have to initiate the contact with us. The way it works is Medicare is very, very protective of you. I cannot reach out to you in any way, shape, or form unless you're an existing client. Then you will hear from me because that's what I do every open enrollment. If you would like a consultation, you would send us an email, give us a call. We've got myself, Kristen, and or Lauren to schedule some time with you. We really are not meeting with people until after the 15th of October because that's when we have all the plan information. And we're going to ask you to bring information along and send it to us in advance so that we can be prepared for that appointment. You will get personalized attention and guidance. Know with me, I am not going the way of the computer or digital this or pushing you there. I'm here to hold your hand, whatever it's going to take. I've got a lot of people that don't even have a computer and they're like, will you help? Of course we will help. We'll help you sign up for A and B. I've even had a few people that have trouble with their claims. Now, no, it's really busy, but I have helped people throughout the year. If something doesn't get fixed or they don't understand it, take your paperwork in. We'll try to work through it together. We'll call the company. We'll call Priority Health. We'll call Blue Cross and try to understand why you have some out-of-pocket expense that you didn't anticipate. So we'll meet you in the office face-to-face. We'll do a telephone appointment if you're more, if you're confined or you're just more comfortable doing it that way. I really don't go to people's homes anymore. Once in a great while, if somebody's very, very sick, I'll make an exception. We also will do GoToMeeting and Zoom and any of the other digital platforms that are available. Here's the website. It's nancycourser.com. That's where we would ask that you send your medication list. It's very easy. And we've got a pull down box and you put in your meds and you tell us who your doctors are. And then we can do the analysis based on that. When you call in, you want to make sure you hit and ask for option 2. That's where we schedule the appointments. And option 3 are the questions. So if you have a plan and did my premium go up or what does this mean or anything that's more of a general nature, either plan or a Medicare kinds of question. Another thing is people will move. So if you have a Medicare Advantage plan, you are going to have to look at a different plan. So I help with people. I've got a gentleman, he's moving to Ohio. Somebody's moving to Georgia. I'm not licensed in all 50 states. I've got a handful of other states, but I also have a business partner who's got all 50 states. So we work closely together. So if you ever move and you have a Medicare Advantage plan, you don't have to wait till open enrollment or the annual election period. They will give you a 60-day window to make a move into your new plan, and it's called a special election. They will allow you to do something special. There's the email address. You can either send it to me or you can send it to Lauren, and we will respond. We generally were pretty good within 24 hours. Now it might be more like 30, but we promise we will definitely get back to you within 1 to 2 days. If you leave us a voicemail, we'll also return your phone call, but we'll do it your way, whatever is easiest and most convenient for you. So that is the end of the presentation. I hope that this was helpful. Again, our goal is to help you make a safe landing this year. For those of you that are on Medicare, if you got an agent, go back. I recommend and say, hey, I want to make an appointment with you. I want to review the plan that I have. If they're not independent and you have an interest in talking about other plans, because maybe you don't like the one you have or it didn't work the way, or you wanted to see what else was out there, we're more than happy to talk to you.